On behalf of Region 7 and the Ask for Respect Supplemental Grant, we want to welcome you to our series of interviews focusing on the perils and pearls of lessons learned regarding COVID-19. Our hope is to share the lessons our colleagues have learned and to assist you with your healthcare journey during this pandemic. Thank you for listening.
Welcome to the Region 7 Zoomcast. I'm David Cates, a clinical psychologist and the director of behavioral health at Nebraska Medicine. Our topic today is how the COVID pandemic is affecting healthcare workers and how healthcare workers are coping. Today we have with us Christina Johnson, Beth Ann Weniger, and Michelle Cavanaugh, all working in healthcare on the front lines of the pandemic. I'd like to start by having our guests introduce themselves, including where they work and their roles on the healthcare team. So maybe Christina, you could get us started.
Absolutely. I'm Christina Johnson. I am the nurse manager of 7UT, which is our primary COVID unit here at Nebraska Medicine.
Thank you. And Beth Ann Weniger.
I'm Beth Ann. I am a staff nurse here on 7UT. Christina is my manager.
Thank you. And Michelle Cavanaugh.
Hi, I'm Michelle. I'm the Nursing Professional Development Specialist here on 7UT COVID.
Well, thanks so much for joining us. So we know that healthcare workers have been under tremendous stress since the start of the pandemic, and there have been countless studies done in this country and internationally documenting high rates of stress-related symptoms like insomnia and irritability, muscle tension, also higher than pre-pandemic rates of emotional exhaustion and burnout, as well as things like depression and anxiety. And I'm wondering how much of this you've been seeing among your colleagues, or even among yourselves, if you're willing to share any about how this has been impacting you. And we can start, anybody can jump in.
Oh, I was just going to say, I feel like we see a lot of anxiety among our healthcare workers and burnout, just related to what's to come and what we're going to see here in the next few weeks. I think there's a lot of anxiety that surrounds around that.
Around the fear of the unknown.
Mm-hmm. Correct.
It's the fear of the known, because last time it was unknown. This time we know a little bit what we're going to face.
In terms of like, if there's a certain, like what are people most afraid of happening?
I think that we're not going to have enough staff to deal with the number of patients that we're going to have. And that I think that we won't be able to provide the care that we want to be able to provide, the level of care.
Yeah. Christina?
I was going to say, to Michelle's point, talking about anxiety, I've heard a lot of people talk about anxiety the night before a shift, not knowing what they're going to walk into, what they're going to experience the next day, how short that shift might be. And I think everybody on our team has gone through different phases of that anxiety, the irritability, the depression type symptoms. And I think we have a really good team here that has all really supported each other, but I think we've all hit that at separate times. And I don't think there's anyone on our team that hasn't experienced some sort of mental health symptom from what we've seen over the last 18 months.
Yeah, I would say if you haven't, you're not human, because it's just impossible to experience all of this as a human being, even if as professional as everybody is. So I wonder, in addition to sort of, we mentioned like the not being able to meet the patient needs and maybe inadequate staffing, what other kinds of major stressors you've been seeing, like, witnessing patient deaths or, infection control protocols or changes in workflow? Is it the nurse-patient ratios? What would you say are like the top few sources of stress? I know we touched on it a little bit just a minute ago, but wondering what else there is.
I think I hear a lot about the nurse-patient ratios, just because as nurses, we like to get to know our patients. We like to make them feel comfortable as they can in a hospital setting, especially when some of the patients still can't have visitors. So I think it's hard on nursing staff when they go home and they feel like they haven't had the time to really get to know their patients. I think that's a big stress on them.
I think it's also hard too, because you worry, did I forget something? Did I get to everything? If you have more than one patient and they're not doing well at the same time, I can't be in two places at once. Like, am I going to be able to manage everything that needs to be managed that day? And thankfully, We have an amazing team that supports us and helps us in those moments, but they're still stressful and scary. And I think I personally worry about, am I enough to take on to handle what is being asked of us with these very, very ill patients. And then I think the other thing that's hard for me is watching these patients that we pretty much know they're probably not going to make it, and wanting desperately for them to make it and doing everything that we can, and knowing that the outcome is probably already set, that we probably aren't going to be able to save this patient, and still pouring out our hearts for this patient and trying everything we can, and knowing that it's probably not going to change the outcome, I think is just it's not necessarily stressful, but it's just a heavy burden to bear.
Can I just follow up on that? And I've talked to a lot of nurses, but if you could say a little bit about how that's been different during the pandemic. And I think it's probably important to say this is an ICU, usually an ICU that we're talking about. So when you talked about having even more than one patient, but what has this been different in terms of that feeling like we're losing patients despite all of our best efforts?
Yeah, I think so. Sorry. I would say that, I worked in an ICU my entire 12 years here. And while as nurses, we see death, we see, those hard scenarios. I think the difference with this pandemic is that it's one cause. It's one cause that's affecting this. And we've had so many deaths from this one cause. I mean, we had in a 48-hour period, 12 patients die. That's a lot of death in a small amount of time. And that's really, really hard for staff, especially now when it is preventable. It's become almost even harder to see that and to hear the regret in people's voices when we're getting ready to put them on life support and they regret not getting the vaccination at that point.
Oh.
I think that's a major stressor for our staff right now too, is just the misinformation and disinformation that's out there. And our staff, see all of this firsthand, and then also see all of that in social media or out in the community, and just battling that day after day is really draining. So I think that's a big stressor for people right now as well.
That makes sense. And we'll talk about coping in just a minute. I wonder if in the beginning of the pandemic, a major concern for healthcare workers was contracting COVID themselves, spreading it to family or friends. Do you think this is less of a concern now that healthcare workers who want to get vaccinated can and have?
My concern now is not contracting it from work, but contracting it from being out in the community or from my kids bringing it home from school, and then being out from work and knowing the impact that would have on my coworkers. I feel comfortable at my job. I have appropriate PPE. We've got everything we need in order to protect ourselves. I'm not worried about that. It's what the impact of getting it would have at work.
We've proven that our PPE practices work. So I don't think that that's as big of a stressor for people anymore. But again, I think, like Beth Ann said, if any of us contract COVID out in the community, it has a huge impact on our team here and our ability to take care of patients.
Michelle, did you want to add to that? Or
I was just going to say that even in the beginning, they were doing studies on antibody testing on nurses and people that were in the COVID units prior to the vaccines. And, people that I've talked to that were within that study never developed antibodies, which just proved that our PPE was working.
That's great. And you talked before about losing patients and the stress that you go through and the frustration, and also knowing that it's in most cases preventable. I wonder how much of that you bring home. Are you able to keep work at work? Again, I'm sure it's not a perfect separation, but if you can talk about just the extent to which you can sort of keep home separate from work, or how much it bleeds over. I think that's so important for mental wellness, but it's hard to do. So I don't know, in any order, just to talk about how and if you're able to do that.
I think, like Christina talked about, it's hard when it's all around us. We can't escape it because it's on social media. It's topics of conversations with friends and family, deciding whether or not to go to church, just a simple trip to the grocery store and walking around seeing everyone that's not masked. It hits a little bit differently. It's different when you're dealing with a patient that might have heart disease, and then, you're able to just walk away from that. But when everything about what you're doing at work is all around you at home and in your community, it's really hard to separate the two, I think.
That makes a lot of sense. Maybe even imagining this person you're seeing, like, that person could end up on my unit, in that way, connecting, everything you're doing. Michelle or Christina, did you want to comment on that?
I agree. I think it's been a challenge to separate. I've had to take some social media breaks here and there, just for my own mental well-being, because of the things that I've seen and read, from people that I respect and care about, that have different viewpoints. And, it's hard to battle those types of things every day. And like Beth Ann said, anywhere we go and, you see the people that may not be masked, and it was really hard for a while to not take some of that personally and not to get angry or resentful about some of that. And, you just have to remind yourself that everyone has their own personal choice, and they might not have the perspective that we have, and trying to keep that in mind as you're going forward. But it's a hard separation to keep work just at work, like Beth Ann said, when it's all around you when you're outside of work as well.
Michelle, what's your experience been like?
Very similar. And what I would tell people is, and myself, is you have to let go of social media a little bit. I think that for me is my biggest point of anxiety, because you really want to fight everything that you see, and it's just impossible to do that. So I've kind of made a rule for my house at 4:00 on Friday. We're not going to discuss this. Like, the social media gets turned off. I'm not going to watch the news, to kind of relieve a little bit of that anxiety when I'm not here.
That's great. We call that like a media diet. And we often recommend people just like get 20 minutes of news in the morning, maybe, a little news show at the end of the day, and just not to be constantly plugged in, because not only COVID, right, but so much hard news to digest, climate and Afghanistan and elsewhere. So that sounds like a really wise choice for your family. Before we move into coping, I just wondered, how do you know when you're feeling stress? Like, what sorts of either physical, emotional, behavioral, or even cognitive, like sometimes people get confused or have trouble concentrating, but how do you know when you're under stress, so that it's like, okay, I got to do something, like this is really weighing on me?
For me, I think my family would tell you a little irritability and frustration. And I would say I find myself just, thinking about work or thinking about COVID, and I really have to reel that in and get myself in the moment when I'm at home with my kids, with my family, to help combat that a little bit.
It's interesting, because some of the signs of stress are more or less visible to other people, but for you, these are behavioral signs that everybody can see. You know it, and everybody knows it. Yeah.
For me, it's when I can't get off my phone. I know that something needs to be addressed, because I'm not coping well. And ironically, one of the things that I will catch myself doing is scrolling through social media, which exacerbates the problem. And so for me, I've, like Michelle, tried to set some limits on social media, and be aware, just have that awareness of, this is like the third time that I've checked in on this app today. What's going on? I need to check in with myself and figure out what is bothering me and how I need to find some release for that, or a healthy coping mechanism.
I would agree with both of those things. I think irritability is certainly one of mine. When I'm stressed and not coping well, I think another thing that I struggle with sometimes, and I notice when I'm not coping well, is I get easily overwhelmed with other things that are happening in the world. So, if you talk about the other things, with the what's going on in Afghanistan, or, the political justice stuff that was going on last year, I found myself getting very overwhelmed with other things that were going on. And it felt like my only capacity to care for things was completely involved with COVID. And so it was very hard for me to separate some of that and really take in other things that were going on in the world. Maybe just a limited capacity for caring. That sounds terrible, but.
No, that makes perfect sense. You sort of fill up your bucket, as it were, of what you can tolerate, and anything over that, whatever it is, could be minor. You're just irritable. It's hard to manage, and that makes a lot of sense. And I want to sort of turn to what you do to manage stress, and maybe this will be helpful. And just going back to like what Beth Ann was saying around you see yourself sort of doom scrolling, or maybe or checking your apps. And that tells you, okay, something's wrong here. And it's so important to have those cues, because then you have to be conscious about, okay, what do I need to do now? Because I'm seeing that I'm doing my stress behavior. What do I need to do? And it's funny, because often when we're stressed is the time we're least likely to do the thing that helps us with our stress. Like we have our head down and we're just focused, and it's exactly when we need to be doing something that can work, and we don't do it because we're so caught up in it. So I wonder what kinds of things you do that help you manage stress.
For me, my biggest thing is going outside, taking a walk, going to the park, doing just something fun, something outside.
That's so great. I'll just make a commentary. There's actually a whole literature on the effects of nature on stress. And we find that people who spend, even if we take a group of people and randomly assign half of them to spend some time outdoors and the others not to, people who spend time outdoors actually show better within like 2-3 weeks, better physical and mental health outcomes. So it's actually an evidence-based technique to just be outside. And so that's great. Beth Ann, what about for yourself?
I also enjoy time outside, gardening. I like to do puzzles. I also find, for me, a lot of my purpose in being where I am comes from my faith. And so I look to that too as a source of encouragement and inspiration to continue the journey. I also have found that I need outlets to share some of what I'm going through. I don't always have the opportunity to process that work because it's busy. And so on those days off, being able to connect with people who are willing to hear my stories or hear how it's impacting me has been extremely important.
That's great. And since I'm citing research, I'll just say that social connection is another widely recognized, really critical aspect of wellness, having places to go and share. So thank you for sharing that. As is spirituality and faith also. Christina, how about for you? What are some of the things that help you manage your stress? And it's important to point out you're a manager, and so you have the additional burden of worrying about your whole team and how they're doing. And I was talking with some colleagues today. We decided that the manager job is the hardest job there is, because you've got all the people that report to you, but you've also got all these people you're still accountable to, and so you're in that sandwich position. But how do you manage your stress?
Like Michelle said, I really like spending time outside, going on little mini hikes or going on walks, just getting out in nature. I find that spending time with my son, who's 3, is a really good distraction for me. I know that when I'm with him, I'm less likely to check emails and be involved with what's going on at work. So that's been really helpful for me. I've also been trying to do regular massages, something that I'm doing purely for myself, to kind of help me relax and kind of help break up some of that muscle tension that I get from work at times. So that's been helpful as well. And just giving myself grace on my days off. If I'm not overly productive, giving myself grace that's okay. And maybe that's what I need to recharge to be ready for the next week. So giving myself that time.
Yeah, that's great. Those are great answers. And I hope people listening take some of that to heart. I wonder, and maybe the answer is no, you haven't, but I'm curious if any of you have sort of learned any formal sort of techniques for managing stress. We teach in my field people things like a body scan or doing visualization or mindfulness techniques or even deep breathing. I wonder if any of you have incorporated any sort of formal relaxation techniques in your stress management.
I will be honest, I've tried body scans in the past and I have a really hard time slowing my mind. So I really struggle with some of those body scan techniques because I can't get my mind to quiet down enough. That's why I think massage has been great for me. For some reason, that is something that I can just kind of blank out for that whole hour or so and, really not think about anything and just enjoy the moment. That's been the most helpful for me.
I don't know if I do it correctly, but deep breathing has been big for me. Just taking a moment away from everyone and shutting out the noise a little bit and taking a deep breath, for me has been a big help.
That's great.
But yeah, I don't do anything formal like that. I have my own sort of routine that I do with stretching, and then I put on my favorite music, and then I'll take a long shower and just kind of like stretch in the shower. But it's not formal. It's just what works for me.
Yeah, no, it doesn't have to be. I was curious. We do a lot of teaching of those things. There are a lot of apps and websites that support mindfulness practice and other things. I was just curious how much maybe that's penetrated or caught on. There's some people who sort of swear by that. Christina, the example you gave, or like you try to do something, a body scan, and your mind is just going in a million directions. I mean, that's sort of like so common in our society. And again, we study that kind of thing, and they find that most people spend about half of their time thinking about something other than what they're doing, which is kind of amazing. That's how just distracted we are. But it is a skill you have to practice, like to actually learn to focus. And you can start, like Michelle talked about, deep breathing. Like when you're doing that, if you just practice just focusing on your breath while you're doing it, even if it's 10 seconds, you're like starting to exercise that muscle of just being able to focus on one thing. And that is something to aspire to, but it's hard for all of us, especially with so much distraction these days. So I want to go back to social support, which a couple of you mentioned. And I'm wondering if you find that the healthcare team itself provides that support, or whether you find that you and your colleagues primarily get support from outside of work and from others, or maybe some combination. But I'm just wondering how much sort of support you can get from within your team and how much you have to supplement that outside.
I think for me, I get a lot of support from my team here. The biggest reason for that is, I think people outside of these walls can't necessarily grasp what it is we're going through. So, it just helps to talk to people who know exactly what we're talking about and what we're going through. I think that's really helpful.
Yeah, I would agree with that. I think our team is incredibly supportive, and we've been very intentional about trying to have more of those conversations around the table at lunch in the break room, just talking about how things are affecting us and how we're coping. And I think one thing that stands out about our team is our cohesiveness and our support for each other, and also just the respect that we have for each other and maybe different opinions or how different people are feeling. And like Christina said, everyone's experienced some form of this affecting us throughout the course of the time we've been doing this. But usually there's always, somebody that's feeling a little bit more up to encourage people who may be down. And I just think overall, our team really has a purpose and has a vision for why we're doing this. And we know that what we do does make a difference, and it does matter, and it is important. Even when we might feel like it doesn't, the collective team still holds that vision and helps us remember that.
That's so important. And just going back to all the patients that you lose, and sometimes it takes a team member to remind, but we didn't lose this patient. We did save this patient, because you can get so demoralized and you can really just focus on the negative. And when you can shore each other up and remember there are some successes in the midst, that's so key.
And even if we don't save the patient, I think being able to realize, that we do have the capacity to make a difference. We obviously want to see our patients make it, but sometimes, regardless of the outcome, we can still feel like it's a win because we know we did everything we could, because we know we did a good job caring for this patient. We cared for the family. We know we did a lot of things really well, even if it wasn't the outcome that we wanted. And sometimes we have to remind ourselves of that too. It's not just the outcome that counts.
Such a great point.
There's a lot of honor in allowing someone to die with dignity. And I think sometimes just reminding ourselves of that is important. But to answer your question, David, I think I rely on my family quite a bit for support, but more than anything, I think our team here is our main source of support for each other. Like Michelle said, it's hard for people that don't witness what we witness to relate. In a way, you can explain things to people, but unless they see it firsthand, they don't really understand maybe the emotion or the feeling behind it. So it is really helpful to have, each other that have been through the same things, have walked alongside us through this journey to rely on and support each other.
That's so important. And I know in the beginning of the pandemic, there was a lot of people moving around different units and being separated from their usual teams, and sort of staffing unit all from volunteers from other parts of the hospital or voluntolds from other parts of the hospital. And I know that that can make that hard, but I know your team has had a chance to congeal and become an actual team as you hired permanent people. So it's so great to hear that that's had the benefit of that kind of mutual support. Slightly different question. Are there things that leadership, either at the unit level or hospital level, is doing or can do that you think would be helpful to you? I know that's a loaded question, but why not ask it on this Zoomcast?
I would say leadership, I think leadership has been really great in asking the questions of what can we do to make this nursing shortage and the pandemic easier for nursing. And I've seen changes based on what people have said. So I think that's huge. I also think it's great that leadership has rounded a lot. We've seen them a lot in our unit, specifically asking nurses, how are you today? What can we do for you? And really just to say thank you and we appreciate you. And that goes such a long way. It really does.
Yeah, I agree. I think our leadership has really done a great job of hearing our feedback and taking action and making sure that we feel seen and heard and appreciated. And that, like Michelle said, has gone such a long way towards making us feel appreciated.
And Christine, I know you're in a leadership role, and I wonder what your thoughts are about sort of the limits of what you can do to make people feel heard and appreciated. If you sort of think there's more the hospital, any hospital, should think about doing.
I think any leadership position right now is extremely difficult with the shortage. It's hard when you feel helpless and feel like you can't do more to help your team. Really the main thing that they need right now is more bodies and more nurses on the floor to help. And that's not something that I can easily provide. We're recruiting and trying to hire more people, but, I think the leadership at Nebraska Medicine is really doing everything that they can to make the job easier for the nurses that are here. So short of finding more people to employ, I think they're doing all of the other things, but it is still a helpless feeling. It's very hard knowing that staff are going into shifts that are, short staffed and things are tighter than they should be. And, nurses have more patients than maybe we would like them to. And I think for me, knowing that I can't be here 24/7 to help mitigate that is hard for me and something that I have to work on for myself to give myself a little bit of allowance to know that I can't fix it all the time and I can't be here all the time either. And that's been a big challenge for me to wrap my head around.
Yeah, well said. We have just a few more questions. I wanted to, I'm going to frame this question by saying that, so I've been, rounding on 7UT, our COVID unit, for the last 18 months. And we always work really hard to make sure people know where they can get resources. And, we've posted things, we've sent emails. And so in the last few weeks, I've done a little experiment. When I meet with nurses, I'll say, if you needed help, like, where would you go? Like, how do you know, where are the resources? And sometimes people don't know. They still don't know after all, as much as we've tried to make it clear and, on the websites and everything else. So this is just a sampling. I know, Christina, because in your leadership role, but I wonder for Michelle and Beth Ann, like, if you had a colleague and they were like really needed additional support, it was clear that they just needed something more than just the peer support, would you know where to direct them?
So for me, I send out a weekly newsletter, and at the bottom of that newsletter every week, it just stays there for all the resources that Nebraska Medicine has. So that's kind of my own resource, and then I can send people to look there if they really need additional resources.
That's right. You have your nursing professional development specialist role. So you sort of are accountable for knowing that. That's great that you include that in each of the newsletters. Beth Ann, what about for you? Are you reading do you get to the bottom of the newsletter? Do you know
That's what I was going to say. I was going to say, well, Michelle sends it out every week. So I'm quite familiar with where to find it. But additionally, I know there are those little like pop-up cards that are around the unit. There's signs in the bathrooms. I know we can look on the Now page for like the employee assistance program. We've gotten emails from PINs. I feel like we've, I don't want to say inundated, but we've had ample opportunity for those resources to be available to us. I think one of the struggles, because I've had multiple conversations with coworkers about maybe our need to have some of those resources in our lives. And I think there seems to be a big barrier to reaching out and taking advantage of those resources. And I'm trying to figure out kind of what that is and what that is for me versus coworkers. I personally already see a therapist, so I don't feel like I need to reach out to a new one. But I think back to what we were talking about earlier, we have this fear that people aren't going to understand, that people can't relate, that it just won't make sense, or we might sound crazy, or, because it's hard to put into words sometimes how we're feeling about all of this. Whereas just being able to talk with a coworker, you don't have to explain that. That seems to be kind of the thought process I've heard from many peers.
What a great insight. It's interesting because we often in my field ask this question: why don't healthcare workers, use these resources? Very few actually use them. And we think about things like convenience and cost or stigma. And you're bringing up something different, which is like people, if I bring it up and they don't get it, that's going to be really frustrating. Like, how will they get it? Such a great insight. Yeah. I wonder if you have Michelle or Christina, other additional thoughts on what the barriers are for people who could use the help and know where to get it, but don't actually reach out for it.
I think it's innate for healthcare workers to want to take care of others, and we're notoriously really bad at taking care of ourselves. So you'll always hear people talk about how nurses and doctors make the worst patients. It's 100% true. We want to fix it and be there for everyone else. And it's hard, I think, for healthcare workers to admit when they might need something themselves, or be willing to kind of take that help from someone else, because they always want to be the healer and they want to be able to fix things for other people, and they don't ever want to be a burden. So I think that plays a big role in why healthcare workers don't reach out for help as well.
It's great insight. Michelle, it's going to be tough to add to those two insights, but anything you want to add?
I think too that sometimes people just don't want to talk about it when they leave here. They want their days off to be their days off, and they don't want to think about what happened the day before.
Yeah, that's another great point. Just leave it, just move on to something else if you can. And one of the things we've tried to do here at this hospital is to be proactive about reaching out to make it easier. And Beth Ann mentioned PINS. For those of you not in our organization, it stands for Peers in Need of Support. So we have this large group of people, mostly behavioral health providers, who will sometimes reach out to everybody on a given unit or everyone involved in some negative event. And only a small portion of those get responded to. So only a small portion of healthcare workers who have those reach outs, maybe 10%, will actually reply and avail themselves of it. It's why I go up to the unit just to try to make it easier for people. But I wonder if you have any suggestions for anybody listening who's in leadership or behavioral health about how we can help close that gap, what we could possibly do to try to make it easier for healthcare workers who, are used to taking care of others and who may not want to deal with it once they leave work, and who may not feel that someone like a psychologist is really going to get it because they don't do what we do. Any suggestions for what we could do to try to bridge the gap?
I think just coming forward in person, I think the hardest part of taking that step is reaching out and making that phone call. So if there's someone right there in front of them saying, here's my information, I do think that could bridge that gap a little bit. So it's nice when there are people rounding saying that.
And I think even beyond that, if you're rounding and you identify somebody that might need that help, just in the conversation you're having, instead of saying, here's my information, but can I reach out to you? How can I contact you? Can we continue this conversation later? Because I think having that established relationship and having that person not have to reach out for the help would really go a long way.
It's a great point. So being proactive, not just showing up, but then following up as well.
Yeah, I think that's great. I think sometimes just taking informal opportunities. If you ever wanted to come up and sit in our break room over the lunch-ish hour when we all cycle through, that you would hear a lot of the ways that we're processing. I think, I don't know, one idea I've had is, we could all get together after work, which sometimes happens. Usually people are too tired, but free food that typically does trump tiredness, just to kind of informally sit around and talk. And I think one thing that hasn't been talked about is with HIPAA, I think some of us also worry about how much we can talk about and how much we're allowed to say. And so I think if we had if we could feel safe talking about it and maybe have someone, I don't know what that looks like, to be honest, but if we could have maybe some guidelines or a reassurance or, and just clarify what that looks like, so that we would know it's okay to talk about my patient that died, and know it's okay to share certain things, or what's not okay to share. I think that would be helpful, because I think that is one thing that prevents us from talking about things more, because we're not allowed to talk about a lot of this stuff.
Right. It's a great point. Really good point. Yeah. Thank you for that insight. So here's the last question. It's a chance to say anything else you want to say that you haven't said, for people who may be listening. But yeah, I guess, is there anything in particular you'd like for, the general public or hospital leaders to understand about your work that maybe people don't really understand?
For me, I think the biggest frustration for me outside of here is when people say, like, COVID's just a cold. It's not a big deal. And, it really, to me, is almost insulting as a healthcare provider in this role to see people how sick they are. I mean, we've had patients, young patients, older patients. We've had pregnant women, postpartum women. We've had husbands and wives and parents and their children all die. And so when we talk about this, it's like, I would just want people to know to be kind of cognizant of that when you're talking to a healthcare worker. We're all open to answering questions and kind of combating some of that misinformation that's out there. So come talk to us. Come, we want to talk about this and, let people know, what medications that we're giving and why other medications don't work. And so just being cognizant of, yes, some people don't get really sick from this, but some people do. And those are the people we're seeing inpatient, and being cognizant of maybe someone that you're talking to or that's seeing your post has had a family member that has died from this, or, just being respectful a little bit of what we're seeing here in the hospital.
Yeah, I think I would add on to that too. What we're doing feels very much like a battle. And I likened it to soldiers, and how, I don't think, and none of us as nurses are wanting to try to be heroes, but we want to feel supported. And I think it's easy to look at the military and soldiers that go to war and see how maybe they're very supported, and feel like, where's the support for the battle that we're fighting? And to see a country that's so divided, and like Michelle said, it can just feel really insulting and invalidating, I think. And so just encouraging people to be respectful, to be thoughtful and gracious in their conversations, and just think about how their words may be impacting, or their actions may be impacting the healthcare workers that are fighting this on a daily basis.
Thanks. Christina, any final words?
I agree with both of those things that they said. I just think I wish that the community could understand how tired and worn out our healthcare workers are right now. And it's not all just COVID. I mean, obviously that's what we see on our unit, but there's a lot going on in the hospital outside of COVID as well. And we are full. The hospital is full with COVID and non-COVID, and we were stressed even without COVID being an added burden. So it's not just this experience that we talk about with stress and burnout and short staffing is not just COVID. It's not just our unit that's experiencing this. It's all of our units. It's all of the nursing workforce as a whole. It's everybody stretched thin and they're tired. And so I think if the community can help support the healthcare workers in any way, making sure that they're doing their preventative care and, taking care of illnesses so that they don't end up here with us, that can go a long way as well. I think the healthcare as a whole is really trying to catch up. For the last year, there were a lot of people that didn't get the healthcare that they needed. And now we're ending up hospitalized with issues that progressed farther than they should have. And that's also putting an added strain on the system. So just really being cognizant of what's going on in the healthcare arena and being supportive of all of our healthcare workers.
Well, it's hard to imagine anybody listening to this Zoomcast and not coming away with that appreciation and understanding that you're so wanting people to have. So I want to thank you so much for sharing about your experiences and your points of view, your great insights today. And can't thank you enough, both for that and just the work that you do every day.